Hello again, and welcome back to The Vocal Mind. My name is Tirzah Elese, and I am your host here on this podcast where we talk all things education and how and why it needs to change. We are passionate about raising the conversation about things that are long-standing within our education system that possibly are not where they should be anymore for today's world. I am very lucky today to be sat across from Dr. Harvey Loomstein, who is a long-time specialist in all things the brain and biotech, etc. Welcome, Dr. Harvey. Please introduce yourself properly.
Thank you, Tirzah Elese. I'm Dr. Harvey Loomstein. I'm the clinical director of Biotech Institute. And I've been fixing brains for 50 years. And what's unique is that I fix both your brains. I fix the brain in your head and the brain in your gut. The brain in your gut causes all kinds of problems because if your gut is inflamed, your brain is inflamed. And if your brain is inflamed, things just don't work right in your body. I should start off by saying your body is made up of 57 trillion cells, give or take, that are all doing something. Your body is a battery. Those 57 trillion cells need energy. You have to learn as a kid to store that energy so your brain and your body can use it. It's an endless need for energy. A couple of things account for that. Most certainly the food you eat and what goes in your microbiome, what goes in from your nose to the other end. It's very important. And the other thing is sleep, because sleep is when your body fixes itself, and particularly your brain fixes itself. Now, these are all things we didn't know back when I started. I learned, even though I was doing this back in the 1980s, I did it because I watched other people who were neurotoxic. I learned what to start to do with those by treating children. And I started treating children in 1976. And it was simple. Simple because back then we used something called orthomolecular psychiatry, which is still used today. And that's really the application of vitamins, minerals, now it's herbs and other things, to allow the body to heal itself. So back in the 70s, when I started in 76, it was simple. Back then, every kid was on Ritalin. And the parents didn't want it. So they came to me and I basically started them on a regimen of vitamins and minerals, multivitamins and multi-minerals. We didn't know what we know about vitamins today. And lo and behold, we did a little psychoeducational counseling with them and remediation. And they went back to the school. And after 6 or 8 months, they were doing just fine. Today, it is much more difficult.
Yes. Wow.
Let me go on. What happened in the 80s, people started showing up in clinics who had strange symptoms. They were fatigued, they had chronic pain, they couldn't think, but there was nothing wrong with them that allopathic medicine could find, because you had to have certain kinds of tests and techniques to find those things. I was fortunate I met up with a guy in San Diego who was so far ahead of his time. It was unbelievable. I put a brain functioning center, which I worked for a company. I was the representative that was working on something called quantitative EEG, which is taking EEG and letting a computer analyze it. But I was out there for 3 weeks. I learned so much watching him and his patients, because eventually those patients came to me and the people I had working for me. And I learned what he did and what he discovered. And what he discovered is most of these people are toxic, and they're toxic from chemicals that are hurting your body. Back then, it was fairly simple. You had a group of people that lived in a building that was brand new or in a house that was brand new. And the chemicals they used to manufacture all of the stuff that went in there would off gas, and they'd have no ventilation, and they would get sick. And they would come up with the aches and pains, and they would ultimately go to their local family doctor, and he would give them antibiotics that did no good. And I often, or the other way is, you lived in an area that was toxic, like Erin Brockovich. I like to say I was doing Erin Brockovich before she was doing Erin Brockovich. The point is, I learned something. After I saw a movie, I went, oh, that sounds familiar, because we actually had a few cases like that. The way kids are today, those same neurotoxic chemicals plastics really account for the autism that we see.
And this is the thing, I'll just stop you there. There's just so much to unpack. And I think we can, I mean, I know I could listen to you for forever in regard to how we've kind of grown and evolved in relation to our own physical body and care and well-being. But why are we having this on an education podcast, listeners? Well, we've titled this talk, Conditions and Environment for Learning in Mind and Wholeness and in Our Growth. And so this is, the focus is how we relate care of the body to that of our children, and then how we see our children and how we label our children, and how we perceive what they're going through. And maybe if we want to change some unwanted behaviors, etc. Dr. Loomstein and I talked a couple days ago about the impact of how we take care of our bodies, what we put in our bodies, how we enable ourselves to sleep in order to then change perhaps any unwanted behaviors or become that little bit more settled or healthy or well. So this is the connection that we're making today on this talk. And just before we pressed go on the record, you were talking about something back in the 50s, if I'm not mistaken, because we were having a conversation about children who are labeled with ADHD and children who are not sitting still in the classroom, quote unquote, or maybe being punished for the innocence of childhood and acting like kids and wanting that exploration, etc.
Well, I was one of the kids I'm going to describe, and these are kids that basically were disruptors. In fact, my doctoral dissertation was on the aggressive disruptive child that now is the antisocial child. Well, what happened in the 1950s was the beginning of using these chemicals. These chemicals really started using in the manufacturing of goods in the 1950s. We also had a lot of something called heavy metals floating out from gasoline that we used. And remember, we didn't have the ability to measure this. Oh, it's going off in the air. This can't hurt anybody, until LA came along, and then you could see it. So you're breathing all of this. Now our food supply was healthier. That's true. But you can have lots of things can happen when you're born. Lots of things can happen between the time you're born and the time you reach 20 or 22. And all of them have an effect on the brain. Right?
Yes.
Your brain is developing. So what do we have? We take a kid, and little boys are much different than little girls.
That's for sure.
I learned that as, man, I used to sit there and watch girls, and I used to think they're all so sweet and they're all so kind and they all get along and they all little boys fighting. And I found out later that wasn't true, but I thought that. And so what happened with me and people like me, remember, they didn't have drugs back then.
No.
They didn't have, Ritalin didn't come along, I don't believe, until the 60s. And in the 50s, they didn't have anything. And God knows they wouldn't take you to see a psychiatrist, because no kid needs a psychiatrist. So for me, I had a lot of the symptoms. I had extremely poor handwriting.
Okay.
I always thought not only inside, around the box, but out of the box. And I had other ideas. And you're made to conform. When you're in the public schools, and we were in one of the best public school systems in this country at that time, and you're made to conform. That goes on today in the classroom.
It does. It's
we
still
don't care what Johnny does. We don't care what Johnny does. Johnny's got to sit there.
Yes.
So the drugs help you sit there. By 1960, I didn't need the drugs. Nor was nutrition a known quantity.
Yes.
We've only learned since I've been dealing with the brain that the brain really, we say at 18 you can make good decisions. Well, no, that's not true. Some brains don't mature till they get to be 26.
Yes.
And adult and behavior wise, some of them never do mature, but the brain matures. Now, we talked about the 57 trillion cells, give or take, in your body. And I don't know where that number comes from. I'm not making it up. I've heard many numbers, but 57 trillion is a nice round number, and like Heinz ketchup. So these cells are always working. They are always doing something, producing energy or producing chemicals or producing something else.
Yeah.
And they need energy. Now, here's where things have changed. Back before the environment became so toxic, we could eat a hamburger and French fries and a Coke and eat pizza and it wouldn't bother us.
Yeah.
But it's one more stress that takes away from our energy.
Because it has to repair something that we put in our body that's not so healthy.
Right. And if we don't put anything in to repair it, the damage becomes more. And so what happens with kids is they are boundless energy, but they need sleep. One of the things we found out is that teenagers need more sleep than keep growing up. Well, that's just the opposite of the way things were when I was a kid. By the time you reach puberty, get your butt out there and go to work. Come on, let's go. And, don't stay in bed all day. I don't know if I turned out any worse for that, but it is something that I recognize now and recognized back in 1991 that sleep is a really important part of healing and health.
Yes, it is.
And the other thing is, we didn't get a lot of minerals in our brain, in our body back then. And so it depended on the environment you were raised in. But if you were raised in an environment that had a lot of conflict, that was another stress. And so what happens is you're always on guard. It's something. So you end up being a little paranoid.
Then you've got anxiety on top of a tired body.
Right.
And maybe stressed gut because it's trying to repair.
And if you live in that environment and you can't repair that because you don't have the right stuff in your body to repair it, then it shows itself in behavior. And I often say this, most behavior, aberrant behavior, comes from anger. And in Chinese medicine, there's a saying, unexpressed anger finds expression. And I can tell you that for sure.
This is one message I used to say to teachers all the time. Behavior is a communication, and it's a child communicating something that maybe they're not finding the words for. They're unable for whatever reason, whether it's anxiety or neurodiversity or whatever. So it's coming out in their behavior. And I think it's linked to what I shared with you right at the beginning when we first met today. These TikToks I'm seeing on my phone from teachers really stressed that kids are not sitting quiet long enough, not listening long enough. Oh, I challenged the kids to be silent for 60 seconds and none of them could do it. It's these types of frustrations that teachers are having. And yet it's not that it's super bad parenting necessarily. It could just be that we're not getting it right with helping the body to be completely aligned and as perfect a version of human as we can rear is in regard to health and wellness.
I would venture to say that these kids are in an inner city school, are in a school in an area that's low economic. And when you're hungry, your brain tells you to look for food.
Survival.
That's right. It's survival. It's survival. So when kids go to school hungry, can't think. And so when the teacher says, be quiet for a minute, now they can't. However, we also don't train teachers. Now, I don't know if that's true today. I think it's still true today, but it was back in the 80s and the 90s when we ran a service for kids. They don't train teachers how to deal with that kind of behavior. Special ed teachers deal with that kind of behavior. And we always hired special ed, certain kinds of special ed teachers that could have been good counselors. Because if you can convey to the kid that you accept his behavior and understand it, then you can teach him how to control it.
And meet the need. I think one thing that's interesting as well which is why I'm doing a podcast like this and hopefully directing or highlighting it to teachers is teachers additionally, from my experience, I was a teacher for many years, we're not trained about actually the depth of the brain. And what you said right at the beginning, that we have two brains, we have the one in our gut and we have the one in our head. Additionally, one could argue we have the one in our heart too. And if they're not all really aligned, then we're not having our neocortex functioning to its highest capacity, and therefore challenging it to think and be creative and be obedient and be engaged is we're shooting ourselves in the foot as teachers. And yet often they're just immediately putting band-aids on or labels on or judgment or shame or punishment to try to change it, rather than realizing, oh, there's something deeper that's going on here that we need to heal or fix or help.
And what happens is we go to the doctor, and there was a doctor here in Dallas. That's all he did is he wrote prescriptions for Ritalin. That's it. And now it's prescriptions for Adderall. And they have their place. And I when parents came to me, I said, given the kid that back when I was a resident in the hospital, I would have said you put a leash on the kid. I saw kids that were that bad. Put a leash on them. We should thank God that we have those drugs, because if they're going to work, they work like that. And that the kid can sit still for a while. Why? Because it increases the electrical activity going through the midbrain, and it lights up the cerebral cortex.
Mm-hmm.
And
Okay.
what are you doing? You're putting more energy into the brain, chemically.
Okay.
Chemically, you're putting more energy in. Anytime you can put more energy in, people are going to do better, because right. memory is a function of attention.
Mm-hmm. Mm-hmm.
When you can't pay attention, it leads to frustration, and frustration leads to anger, and anger, it all revolves around dependence.
Interesting. So, dependence on what? Explain that more.
People don't like to be manipulated.
Right.
When people can take direction, but if you think you're being manipulated, think about school and teachers.
Yes.
If you think you're being manipulated, you understand that on some level. You may not understand it in your brain, but somewhere you understand this is not in my best interest, and you get angry. That's where the
powerful. Yeah.
Because you're dependent on that teacher. I dealt with kids from up until 1980, 89. I dealt with kids, and I used to say to the kid, "You flunked gym. Do you know how bored you have to be and I wouldn't say angry, I'd say bored. We had to get to the anger.
Yeah.
Right? Or the kid got straight F's. I said, man, you work hard doing that anyway. Huh? Well, you've got to sit in class 8 hours and do nothing.
Yes. Yes. It's interesting. That's such an interesting point. I want to pick up on that because I've had a lot of debates with teachers about this, where they're like, oh, they might say he's lazy or he's disinterested, etc. And he's choosing the easy path. But I'm agreeing with you at this point. No, that's actually a hard thing to do. It's hard to be disengaged completely and to stand out from everything that you're meant to do and to sit back and be quote unquote lazy. Actually there's stress going on in that person. They know that they're not fitting in or following the crowd, and humans don't really like that.
Or bad things are going to happen to him or her. Now it includes girls.
Pardon?
Now it includes girls.
Yes.
That's when I was thinking it didn't include girls. Now it does include girls.
Yeah. So what can we do as sort of parents and educators and people to support kids to get more of this energy? Maybe if we don't want to go the Ritalin route initially, and I think we should do everything before, right? Would that be your advice?
Well, my advice would be to get a few of the vitamins and minerals, because we didn't have tests back then, and try that first.
Yeah.
And diet.
And sleep.
Now, it may be that the blood is so polluted that you need to have the Ritalin. I'm sorry, Adderall. They still make Ritalin, and it still works on some people, but the drug of choice is Adderall. And Adderall seems to work because it turns up the burner.
Right.
Right. The other thing that parents need to be aware of, and my parents weren't, is what's on your permanent record. And that permanent record that you're really reminded of starts in kindergarten. And if I'd had a different kindergarten teacher, I may have turned out differently.
Interesting.
But what was interesting is I was hired at a university near here. I was doing part-time teaching. And I had a note in my mailbox that Dr. So-and-so wanted to see me. I recognized that name. He was either my 10th or 11th grade English teacher.
Okay. Interesting.
And now he was at this university teaching special ed or stuff. So, and he made his comment. He said, he made a comment. I know this guy, and if he can make it, anybody can make it. Now you begin to think, well, what was on my permanent record? But I didn't want to see it. I could have, but I didn't want to see it. But I figured what was on there. And once you get labeled, that's a big thing. Once you get labeled, that label goes with you forever and ever. In the school district.
It's terribly sad, but it's true.
So parents need to be aware. When I first came to Dallas and opened up my practice, I was aware that one of the big school districts here had the parents help out in the classroom. I thought, wow, that's really a great idea, because it gives the teacher a different perception of the parents. And every kid that I worked with, every month, we would send out a questionnaire for the teacher.
Okay.
I mean, I would look at them. I didn't put much into it. But what did that do? What did sending out that questionnaire do?
I mean, engage them as part of it.
Right, engage the teacher. Let's look at this kid in a little different light.
Yes.
Let's do what we can to help him. Because how would you like to go to work every day and you know you're going to fail?
Mm-hmm.
And people are going to call you stupid and dumb, and no wonder why they want to go to the nurse or go to the bathroom.
That's right, 100%. And it really is about what can we do to help our kids to really bounce forward and bounce into a place of their own brilliance and understanding what that is, rather than living in this place of shame or always getting it wrong. And if really good care and diet and understanding that sleep and these energies are going to ignite their brain, that's a really powerful tool to have in our toolbox.
It is. And my goal with what I do with all people is I work to put your immune system back into homeostasis so it works. And all kinds of things can affect your immune system, but particularly what stress that you get in the classroom and what you eat. And most people don't realize this, that it really is, your body is just reacting to what you're putting into it.
Yes.
As an example, I had a little kid that came to me and I had to see him on a Sunday. And so I had bagels and cream cheese, and I'm watching the kid and then I came out and I said, I want you to watch something. And gave the kid some cream cheese and he went nuts. And then I took something called evening primrose oil, and I poked it and rubbed it on his skin, and then he was sitting down playing again.
Interesting.
You have to have an awareness of when kids do what and to whom. The teacher doesn't have enough awareness of time to have that awareness.
Yeah.
The parents do. So my advice would be that you start your kid on some multi-minerals, because minerals are what are really important, because that's what makes the furnace in your body work.
Beautiful.
That causes the spark.
That's beautiful. It's amazing how it's so connected. This, what we're putting in it and what's going into our stomach and into our veins and whatever is directly empowering or disempowering our brain. And that's through the energy that our body needs. That's such a powerful message.
And the body needs so much energy to grow. And people forget that. Your body can, when you're older, you can take a series of hits.
Mm-hmm.
But when you're a little kid, and this happened with my granddaughter. My granddaughter just had back surgery. It was a big thing, but it wasn't like it was back in the 70s. It was much different. And now, 2 or 3 weeks out, she says, I don't feel good. And her parents don't. I said, she doesn't feel good. Because the reserves that she had built up were used. And now your body has to build those reserves up again.
Yes.
What happens when we hit 35, 40, certainly by 50, we start using those reserves unless we keep putting the nutrients into our body that our body needs.
It's amazing. And I think as we're younger, we take for granted that level of energy, especially if we come from a healthy family. Right. And, we've always had good food. I know for me, it's been a huge impact kind of going through the menopause journey, the perimenopause. I've never been one to be weak or feel exhausted or not sleep well. And all of these changes in my body is something I'm really having to focus on, because it does impact how I function in the day and as an entrepreneur. And similarly to my daughter, she was raised only on healthy food because I'm a bit obsessed with that. And, lots of sport and lots of family time, etc. She's had a baby. And then I think it was about 11 months after she had a baby with a cesarean birth, she's pregnant again, but she's gone back to work. She's raising a 1-year-old. She's pregnant. And she whinged the other day. Oh, I feel really bad. I'm just not so strong. Like, of course you're not. Look at how much energy your body is using up right now. And I think it's about being aware of it, and not just expecting that we're going to be well. We have to put the right things back into our body. We have to give our kids that good.
Absolutely. And what happens is there is a line out there, not a line, it's a storyline, that vitamins and minerals don't help.
Right.
And anything that the drug companies don't control doesn't help. I'm going to try not to go there, but I might have to. and the thing is, it's the vitamins that you get and how much of the vitamins get into your bloodstream. It's called bioavailability. 95% of what you buy in the supermarket or the vitamin store, it doesn't work. In fact, in many cases, it's worse. And it makes things worse because of the way they manufacture it.
Okay. And so they kind of have stripped out most of the good stuff.
or they put bad stuff in.
Wow.
And a lot of times they're finding out with these protein drinks that they put lead into them.
Wow.
Lead, we know lead is going to affect your brain, especially the developing brain, and it's going to have profound impacts.
Wow.
So the other thing along with that is a lot of these kids in special ed now, they get this evaluation.
Okay.
And based on that evaluation, they are trapped the rest of their life in school.
Yes. And immediately someone's got an opinion of what they're going to be like because of this evaluation. So
That's
it's almost like predetermined. And I know that there is, I mean, that's a whole other podcast, but tell them they're beautiful and beautiful they'll be. And the opposite is true as well, right? So if you already think that this child is going to be difficult or labeled as whatever, your behavior towards them also alters.
You have the word think. See, one of the things that I realized working with these kids is it's all energy.
Yeah.
It's how do you put energy into them? And it started out with my voice put energy into them. And then I got into doing electromedicine and using acupuncture and magnetics and electricity. We were putting energy in. So I was able to put the energy in without the pills.
Mm.
Right?
Yeah.
And once you can fix the brain, it tends to stay that way.
That's beautiful.
If you nurture what you've done.
Yes. So sort of maintain those good habits, etc.
Right. And so what I realized, and I didn't use electricity on kids or magnetics on kids. I actually treated 3 children when I changed my focus using the magnetics, and they went through exactly the same stages that they did when they were in play therapy with me. Wow. But back then, the way we used magnetics is we had a pair of headphones on and some wires and going in there, and that could upset a parent.
Yeah.
So I didn't do that. I used play therapy and wondered why what I did worked, but I found out later on with frequencies and energy medicine, it was my voice.
Interesting.
Right.
So powerful how we're so connected to all of that energy.
And that's why some therapists can treat anybody, and some therapists can't help anybody.
Mm.
A lot of it is in your tone of voice and the word, and especially the words that you choose. Why?
Yes.
Because words are energy.
That's right.
And one of the things you can teach kids is how to think good thoughts about themselves.
Such an amazing point. Yes, 100%. It's my whole company basically is rooted from that.
Right.
From that belief that every kid needs to know what they're amazing at. And we start from that and grow on and grow from there.
And now we have their secret power, which I think is something on TikTok. I don't know. My wife talks about it, and other people. Your superpower.
Yes.
Every person has one.
That's right.
How do you help them find that?
It's beautiful. It really is my slogan. Find your superpowers. It's wonderful. Yeah.
And how do you do that? Well, if you let kids just be, they will gravitate toward what they're good at because they know.
That's right.
By the time they hit 3rd grade, they know who the athletes are. Right.
That's right.
By the time
and who the readers are and who the drama people are.
Right. The kids that are good go on, and the kids that aren't drop out. But every kid is good at something.
That's right. That's right.
And so how do you help them? Just watch.
Stand back and watch. It's exactly right. I mean, it's one of my messages to teachers is let's stop teaching and start learning. Let's stop, insisting on this is what we're going to do, and stand back and watch what's going to be born from this brilliance that we, invite into our spaces. Just quickly, going back to what you were talking about around the vitamins, and you said a lot of what you get in the store is either not worth it or maybe detrimental. What should we be doing instead? So let's say we're finding some difficult behaviors. We're struggling with this, what is clearly now evident is a lack of positive energy in this child or this young person. And we want to bring out the excellence and we want to allow them to thrive. Is it really healthy food? Is there other supplements that would be worthwhile for parents to note that are healthy, that are the good things? I mean, my mom was, everything natural from the ground and then you're good. But
yeah, if it didn't grow, don't eat it. I'm not too. The problem is our food supply is so polluted that when it rains glyphosate. It rains glyphosate.
Yeah,
there's so much of it out there, and that if it's taken in large dosages, that's what causes what we call metabolic diseases. And a metabolic disease is you're not sick, but you're fixing to be sick. which means you're obese, diabetics. I mean, we have kids now that are diabetics, and heart problems. And these things, if left untreated, they turn into chronic illnesses. Chronic illnesses, if left untreated, turn into autoimmune disorders, including but not limited to cancer.
Yes.
So because your body is AWAR. Now, what could you do as a parent? For one thing, you're never going to get the kid to give up pizza and hamburgers. It's not going to happen. So the best thing you can do is put into the body to fix the damage that those foods do. And I would say if you're going to buy vitamins and minerals, buy well-known brands. If you happen to have a health food store, when I started in this, there was a man here in Dallas who was just phenomenal. And I would go down and talk with him and say, I got a patient who does this, and here you need this. Okay.
Yeah.
And he knew, I'm going to get, no, don't buy that one. Because he knew the way it was made.
You talk to the experts and really get it.
Right. And find somebody like that in your town. There are people that we call naturopathic doctors now, and there are many of them around.
Yeah.
And they can set you on the right kind of diet and mineral supplements. But the problem is, you just can't. You're better off to say to the kid, go ahead and eat this, because here's what's going to happen. When the kid feels better about himself or herself, and they start doing well, when they eat that food, they're going to notice how they feel and how they don't do so well.
Yeah.
There was a study that was done back in the late 60s where they took a group of campers that were at camp for 8 weeks, and it was all cafeteria food. And they let them get whatever they want. And so when they started, it was all desserts. By the time they ended up, the kids were eating a balanced diet.
Because they knew how it made them feel, and their body went and sought out what it needed, right?
Right.
Better. Yeah. That's beautiful.
And when their gut's clean and functioning, then their brain is clean and functioning.
And I think that's the key thing to remember today, listeners. When the gut is clean and functioning, the brain is too. And I'm going to have to, I could sit here and talk to you again for another hour. This is so riveting. Yet, we like to keep it as short and concise as we can for our listeners. So I'm going to come to a sum up. And for me, there's been so much, and I'm sure I'm not going to sum it up completely, but some of my key takeaways from today is every kid has a superpower. Let's recognize it. Behavior is telling us something about what the body is needing or what the emotions are needing. And that the gut and the brain work in tandem, and they work in alignment. And if we get that right and we understand it, we can help keep kids from negative labels. We can help keep them as powerful and strong and successful, or enable them to be as they are meant to be from the beginning. Dr. Loomstein, it's been a pleasure. What a wealth of knowledge you have, and I've been so lucky to have you here on my podcast with me. If anyone has any questions or comments for Dr. Harvey Loomstein, please put them in the comments below, or send an email to info@uconnecthub.com. Also, if you want to know more about Dr. Loomstein, you'll have his details. Is that right?
Yes.
Something where they can find out more about you, or maybe speak to you if that's what you're doing or offering. But all relevant details will be below this podcast. Moms, dads, teachers, please remember that our children are as beautiful and as strong as we enable them to be. So let's take this advice today and enact it for our young ones. Thank you so much. Any last words you want to end with?
Well, I offer for people who need it, I offer a free 30-minute consultation.
Beautiful. So they can book that in the link below, yes?
Right, in the link below.
Fantastic. Amazing. Well, we've got medical and we've got heart today. We were very lucky, because sometimes with doctors you get more medical, but I can feel that you have such depth for an understanding of getting it right for our kids. And thank you for sharing that with us.
Yes, thank you.
And once again, that brings us to the end of our podcast, and we hope you enjoyed it. And I know that you're going to have taken some learning from today, because I most certainly have. So thank you once again for listening. And next time we will be back again with another topic. And remember, if anyone hasn't told you today yet, you are beautiful. We'll see you again soon.